Thank you so much, Kinoti, and to Panina and her broader team for the invitation to join you all this morning. It's afternoon for those patching in from different parts of the world. It's a real privilege for us to have this chance to share a little bit about the work that we do here at the Reach Alliance and some of the research insights that I hope will be of interest to everyone on the call today. My name, as Kinoti mentioned, is Marin MacLeod. I lead the Reach Alliance, which I'll tell you a little bit more about shortly. I've been with the Reach Alliance now for almost 10 years, but my actual first work and first love, you could say, is in public health. I studied my master's in public health here at the University of Toronto about 10 years ago. So today's topic is of great personal and professional interest to me, and I'm really looking forward to engaging in conversation. And I hope you've come prepared with questions for us. I know our researchers are really looking forward to that. Great. So I want to first acknowledge, this is Sustainable Development Goal data, but there is much in common with Agenda 2063 targets. So the problem that I see unilaterally in the SDG space, in the public health space, in the employment space, across the 2063 targets, is that we are missing critical and essential data. So the graph here, I think, does a good job of showcasing the gray, which is really that. It's data that's not being tracked rigorously or at all. And of course, then we know policymakers and practitioners, people that make budget decisions, they aren't able to do that if they don't have the data. And what we also know is that this gray area on this data visualization is often overly representative of people that are hard to reach for geographic, administrative, or other reasons. So this picture here really drives home the necessity of the work that researchers and the higher education space and the impact that we can all have when it comes to Agenda 2063, achieving the Sustainable Development Goals. And first and foremost, we have a responsibility, I believe, and we believe at Reach, to uncover those stories, work in collaboration with community, really understand the problems that we're trying to solve in order to provide good and usable data for policymakers and practitioners. If folks on the call have data visualizations or other representation from the Agenda 2063 material, please drop them in the chat. I'm always looking for new data. I'm a bit of a nerd that way, so please do share your resources. I've linked the source. This is the SDG report from 2023. But as I say, please do pass along additional resources, anything we can do to fill this data gap. What really, I think, also motivates the work that we do here at Reach are some key statistics and key data that we do have access to. So for example, in Ghana, 43% of all deaths are attributed to non-communicable diseases, majority of which from cardiovascular disease. Zambia's response to the worst drought in 60 years was delayed by a lack of reliable and actionable data. So at Reach, we ask questions like, how can we bolster access to HIV-related healthcare in Zimbabwe among young mothers living with HIV? How can we improve maternal healthcare services for women who are unhoused in Cape Town? We answer these questions through case study research and data-driven insights. Again, all of this work being done in collaboration with community, with university researchers, students, and faculty. Next slide, please, Kinoti. So what is the Reach Alliance? And I'm only going to spend just a couple of moments here because I think it's more important to really get into the work as opposed to the what. But for the sake of context, we are a consortium of 9 global universities. So on the continent, we work with Ashesi University and the University of Cape Town. We also were founded here at the University of Toronto. We focus on developing the leaders that we need to solve urgent local challenges of the hardest to reach. And we think about the hardest to reach populations as those that are underserved for geographic, administrative, or social reasons. All of our research is done in interdisciplinary teams, so we are also very motivated by the understanding that wicked problems, challenging problems cannot be solved with one discipline or in isolation. So we bring together student researchers from different faculties, and I think you'll get a really great sampling of that here on the call today as we've got 3 different academic backgrounds represented. As I say, all of the work that we do is conducted in collaboration with local communities and with the guidance from university faculty mentors. And we feel, though, this really builds the capacity and the skills of the researchers that go through the program. And again, you'll hear from them shortly, and I think they can speak to some of that journey and experience. Next slide, please, Kinoti, or sorry, Tom. Great. So this is a little bit overwhelming, and I think likely you can tell I am a visual learner. I like color, so I will break down some of the key points that I'd like you to take away from this map. We've worked with nearly 400 student researchers around the world. You can see from the map these Black institutional icons, and those are where we have a university presence. So we have a relatively global network, although there is obviously always room to expand and grow the network. We've published or launched about 100 case studies, and those are all available on our website. So you can jump on the QR code there if you'd like to learn more about those. We've worked with about 50 faculty from across these 9 universities. And just to zone in a little bit more on the region we're focusing on today, about 30% of our case study research is actually focused in Africa, a lot of that being driven by our collaborators at Ashesi and the University of Cape Town. And then about 2/3 or 17 of those projects are focused on health and youth unemployment. Next slide, please. Great. So this is the next couple of slides before I hand things over to the researchers on the call are a bit of a sampling of some of the projects that we've taken on and some of the questions that our teams have been asking. As I say, I've had the real privilege of working with about 400 student researchers over the last 9 years, and I'm consistently inspired and motivated by their vision and understanding that it's going to take an intergenerational approach to research, to learning, and to knowledge exchange to tackle some of these problems. A few highlights here to just call out specifically, and you'll notice, I should say as well, that we focus on published case study research. All of our research is open access on our website, and then many of our teams go on to produce other knowledge deliverables, such as peer-reviewed publications or podcasts or videos. So we had one of our UCT researchers was featured in the Lancet Voice podcast last year for the Lancet's 200-year anniversary. We've got a project that is just recently published out of the University of Cape Town looking at innovative healthcare solutions in South Africa, leveraging private sector know-how and approaches. Next slide, please. We've got some great work coming out of Ashesi, really focused on non-communicable diseases, and I'll leave it there because you're going to hear from one of our researchers. But we also look at other, as we all know, the public health and healthcare space is really at the intersection of so many other issues. So we also look at things such as how do we get reliable energy access to healthcare facilities? How do we build and understand that infrastructure loop as it relates to health outcomes and service delivery, especially in hard-to-reach communities? Next slide, please. Thinking about issues like supply chain. So in Tanzania, we studied their medical supply chain and how that was effectively able to service communities that were rural or hard to reach. Looking again at vaccine distribution, that's a big topic, and many of our case studies have explored that. What are we learning about how to get vaccines not only to 80 or 90% of a population, but the last 5% or the last 2% of a population? Next slide, please. Looking at a project that's just underway now at the University of Cape Town. How do we improve access to maternal health care services for women who are unhoused? How do we improve health education regarding cardiovascular disease and heart failure in Uganda? And then some of our projects have a bit more of a technical focus. How do we leverage drones, for example, to improve supply chain and delivery? So I hope from these examples you can get a sense for the breadth and scope of our approach to research in the health space, looking at the intersection of various sustainable development goals and various challenges when it comes to improving service delivery for these communities. Next slide, please. And now for the main act. Now you're going to hear a little bit from three of our most esteemed Reach Alliance researchers from three different institutions, although Jemila is also an alum of KNUST, so I kind of count her as being part of two communities. They're going to share with you a bit about their research and some of the insights that they are uncovering through their journey, and some of the outcomes that they've achieved at this point in their journey. They're also going to talk a little bit about the experience and the transition from going from being a student at one of our universities into the workforce, and how some of the skills they've learned through their academic background and their training have really contributed to where they are now, or where they'd like to be in terms of their professional next step. So Jemila is a master's student at the University of Toronto pursuing a master's in biomedical engineering, and her research explores barriers to implementing digital mental health platforms for post-traumatic stress disorder in refugee populations. And we're going to hear a little bit about how Jemila hopes to link this work to some of the trends she's seeing on the continent. We're going to then hear from Sikelelwe, who is a master's student specializing in international relations at the University of Cape Town. And as a Reach researcher, she focuses on youth unemployment, specifically exploring employment strategies for youth deterred from completing high school. And then finally, we'll hear from Jochebed, who's actually an alumni of the program and a couple of years out. But we think it's just her work since her project really demonstrates the impact pathway that these projects can have and what this can look like from an implementation standpoint. Jochebed's a recent computer science graduate from Ashesi University. She's got a strong interest and background in AI and software engineering, and she's currently working at UNICEF in Ghana, and is going to really, I think, be able to demonstrate an example of, as I say, the impact that the work can have. So with that, it's a real pleasure and privilege to hand things over to you, Sikelelwe, and thank you so much. Next slide.
Thank you, Marin. Hello, everyone. My name is Sikelelwe Mtshizana. I'm a master's student at the University of Cape Town, specializing in international relations. And under the Reach Alliance, I'm part of the Future Forward team, and our research is still in its beginning stages as we're still going through our ethics clearance applications. But our research centers around the issue of youth unemployment, with a particular focus on those who, for various reasons, were deterred from completing their high school in Cape Town. Now, youth unemployment is a global issue, but in South Africa particularly, it's a critical issue because in the first quarter of 2023, the youth unemployment rate stood at 45.4%. And in 2021, the country's non-completion rate for basic education alone reached 60%. This then means that only 4 in 10 students who started grade 1 ever sat to write their grade 12 exams. And one of the key insights from research from UCT showed that high school graduates often viewed those who didn't complete their education as a mirror of the worst case scenario, which then reinforces negative stereotypes and deepens the social stigmas around being deterred from completing high school. Now, recognizing that for various reasons, education is not necessarily always a viable option for all of those who were deferred from completing their high school, which then drives us to explore any alternative strategies from those who have been successful. And in this context, success being those who are able to sustain themselves with an income. And through our research process, we are also open to defining what success is from engaging with the participants. Now, you might be wondering why we're focusing on Cape Town, considering that Cape Town doesn't have the highest rates of youth unemployment or even schooling non-completion in South Africa. And the main reason is because Cape Town holds significant historical context that continues to affect our present-day challenges, right? So, for example, the Cape of Good Hope, which is just an hour and a half away from Cape Town, was a crucial point of entry for colonizers into South Africa. And the city's history is deeply intertwined with the legacy of colonization. And this history continues to shape the social and the economic fabric of our region. Also, Cape Town remains to be one of the most stark examples of spatial inequality in South Africa as a whole, with extreme wealth on one side and deep poverty on the other side, which reflects the profound legacy of colonization and apartheid. And despite being one of the country's wealthiest regions, the Western Cape is also one of the least reformed provinces post-apartheid. Now, through our research, some of the key questions that we're hoping to address are: what are the alternative strategies that could effectively address youth unemployment for those who are outside formal education systems? We are wondering how we can redesign support structures to better serve youth who are excluded from traditional education pathways. We also want to highlight and elevate the diverse experiences of youth navigating challenges to go against the dominant, narrow, and often negative narratives that exist about them. And most importantly, we want to explore what role a story-driven approach might play in creating employment solutions that are relatable, scalable, and community-driven, which speaks to one of the most important points as to why our research is crucial or matters. And that is because current interventions focus almost exclusively on formal education, which then tends to overlook any other alternative strategies or pathways that might be just as viable. And so by bridging this gap through our research, we then have the potential to redefine how to support the youth who are excluded from traditional education systems. And also, a story-driven approach really humanizes data and helps to inspire community-based solutions that resonate on a deeper level. And so by challenging the single story, we do hope to highlight the diverse and often untold experiences of youth who have been successful, although not going back to complete their high school, because well, this will show that there is no one-size-fits-all solution to youth unemployment. And also, I do just want to mention that while we do have great ambition, we do recognize that a strategy might not be present at the end, because sometimes producing recommendations in case studies is not always possible. However, with this consideration, we do deeply believe that a deep articulation of a story could trigger change in investigation and approach, as our research speaks to navigating political and systemic challenges that are to be addressed by various stakeholders and likely require policy interventions. And this is something that my team and I have been thinking a lot around, which is how to engage people in government. And we would really greatly appreciate any tips or anyone reaching out to share their experience on research, bridging the gap between research to policy advocacy and stakeholder engagement. If anyone has anything to share, please leave your answer in the chat, but I'll also post my question again in the chat. Next slide, please, Tom. And then reflecting on my experience thus far, I think in a nutshell, I'll say that it's been a very enriching experience that has offered me more than just opportunities to connect with various individuals within the Reach Alliance. As you'll see in the slides, I have been in meetings and convenings both in Cape Town, South Africa and Kumasi, Ghana, which have sparked meaningful conversations individually that have sometimes shifted our research, but also reinforced the direction of our work. You'll also see on the slide, there are short bios under the team's headshots, showcasing that we're a very diverse group with very different specializations. Fortunately, this has been mostly to our benefit, as we've been then able to bring together different considerations and perspectives regarding our research. The experience has also allowed for great opportunity for personal and professional growth for us very differently. In my case, working on the research project has allowed me to redefine not just my leadership, communication and collaboration skills, but has also instilled some more confidence in me and our research just by speaking about our project in different spaces and in different people, like I'm doing so right now. And at the same time, this experience has been a very sobering journey, in the sense that the realities and the challenges that are faced by the South African youth, they continually reignite our passion and drive and really remind us of the importance and the weight of the work that we're doing. And ultimately, I'd say that the experience itself has not been linear. but all of the events and all of the meetings have strengthened mine and the team's commitment to the project, and also reinforced my belief in the power of collaboration and research to create meaningful change. As a team, we're very excited to continue on our project, and we look forward to look forward to starting our fieldwork, once we get our ethics approval. Thank you.
Thank you so much, Sikelelwe. Next slide, please, Tom. And Jemila, over to you.
Hello, everyone. Thank you for the opportunity to share a case study research with you. My name is Jemila. I'm a student here at the University of Toronto. So our research is looking at overcoming the barriers to implementing digital PTSD treatments for refugees in Canada. Next slide, please. So PTSD, as we might know it, is a syndrome that develops after the exposure to traumatic events such as threatened or actual death, serious injury, and exposure to war. The lifetime prevalence estimate of PTSD among refugees in Canada here is 20.8% higher when compared to that of the general Canadian population. And when it comes to ways of managing it, treatment of PTSD in Canada is multifaceted, involving psychotherapy, medication, and social program. However, most patients seeking treatment struggle to receive the needed care due to the high cost of therapy, long waiting times, and rescheduling issues. Aside these, refugees specifically are further faced with more challenges like cultural differences, lack of interpreters, and social stigma. And this is where digital interventions comes in, as they show great potential in addressing these issues by reducing wait times. They are cost effective, and they also reduce the strain on services. To get a deeper understanding of the digital mental health ecosystem, the team is collaboratively working with Savintech, a digital mental health therapeutic startup that aims to reduce barriers for patients dealing with PTSD. Our research focuses on how digital health technologies can be scaled and made more accessible for the refugee population by tailoring the platform to be equitable and culturally sensitive. And we intend doing this by investigating how stakeholders, from policymakers to healthcare providers, perceive the adoption of these digital interventions in treating PTSD, particularly for the refugee population here in Canada. And by mapping out their perspectives, we anticipate identifying the challenges in cultural adaptation, policy gaps, financial sustainability, and cross-sector collaboration, providing an insight for improving mental health access. We also aim to uncover the facilitators that could enable the integration of the digital platforms into the existing mental health frameworks here in Canada. In essence, our research is about unlocking the potential of digital interventions to transform the mental health care for refugees in Canada, a lesson that resonates globally and more specifically to our continent, Africa, where I must say there is so much social stigma that comes with mental health and also the limited treatment. And I say this from first-hand experience, as I was a peer counselor on KNST campus for 3 years, and these are some of the issues that I have handled whilst I was a peer counselor on campus. So we hope to apply our findings in other geographies like Africa, ensuring that we provide an accessible and effective treatment for mental health conditions like PTSD. And to give you a bit of update on where we are currently on our research, we are preparing for fieldwork and data collection. And we just got our REB approval, that's our ethics approval, 2 days ago, which the team is so excited about. I was so excited that day. And to just say this firsthand, this is literally my first time ever doing research in social sciences. So I would really appreciate your insights from experience or your inputs regarding our research. And if you also have anybody in your network that you think would be interested in kind of being a stakeholder for like the digital mental health space, please don't hesitate to reach out. I'm going to post my question also in the chat so that you can reach out to me. Next slide, please. Now, talking about my academic and professional journey, Marin did mention earlier, I did my bachelor's degree at the Kwame Nkrumah University of Science and Technology, where I studied biomedical engineering. And currently, I'm pursuing my master's here at the University of Toronto under the MasterCard Foundation's Scholars Program. And I must say, I'm an offspring of the African Health Collaborative Initiative. So yeah, it's exciting to be here doing something for the association and the foundation. I also got a feel of UCT, that's University of Cape Town, where I got the opportunity to intern at the UCT MedTech Lab. And I must say that these experiences have shaped my adaptability and multicultural thinking drastically. I quite remember my first class here at U of T. I was totally lost when I was in the class and felt out of place because that was literally my first time in such a wide and diverse environment. And so it took me quite a while to kind of settle in and adjust. But comparing that to when I started my internship at UCT, I had no trouble fitting in at all, as I already mastered, I can say I've already mastered the art of adapting in a multicultural environment. And that gave me time to focus on my project and also collaborate effectively with other students. My involvement with Reach Alliance also continues to give me the diverse exposure through our global community to learn and gain insights from different perspectives, and highlights being my presentation at the Africa Convening 2024 and also the Reach Annual Conference 2024 here in Toronto, where I participated in a panel discussion about accountability and leadership. My work at the Reach Alliance also enables me to approach complex challenges with cultural sensitivity and a focus on impact-driven outcomes. With that said, thank you so much, and I'll end my presentation here.
Thank you so much, Jemila. Next slide, please. Jochebed, over to you to close us out. Oh, you're on mute.
Sorry, thank you so much, Marin. My name is Jochebed, and I recently graduated from Ashesi University last year, majoring in computer science. And as Marin has already mentioned, I'm very much interested in software engineering and artificial intelligence, but you'll be wondering why I'm here. But I'm also very much interested, and I have a passion for research and healthcare, and that's what led me to join the Reach Alliance. Next slide, please. So in 2023, my team and I researched and published on the no-bed syndrome in Ghanaian tertiary hospital, which basically means or depicts the lack of hospital beds in Ghanaian tertiary hospitals. And this is a crucial problem, as the World Health Organization recommends 5 beds per 1,000 people. But in Ghana, we only have less than 1 bed per 1,000 people. Our research went through different phases, which spans from exploration, secondary data analysis, to ethics and primary data analysis, and then case study writing and publication. You might see it here as a linear process, but it hasn't been easy. It was an iterative process with a lot of changes and refinements to explore the causes and the changes and the causes and the effects, and also the existing solutions of the no-bed syndrome. And during this time, I might say I've had so many opportunities with the Reach Alliance, but I would like to just highlight a few of them. So during this time, I had the opportunity to present on behalf of my team on different occasions, like speaking at the Reach Annual Conference in 2023 in Mexico, but also participating in the in the first meeting with the African Health Collaborative in South Africa, where I also presented on behalf of my team on the African regional convene. Yeah. So I might say after the publication of our case study, which took place in December, it didn't end there. I decided to take this up as my final year's computer science capstone project together with a partner. And we decided to build an AI-powered health information management system to address some of the inefficiencies of the government-based hospital system that's currently used in government hospitals in Ghana. And we decided to take this approach because from our previous research with the REACH Alliance, we got to know that this system also contributes to the no-birth syndrome. And this project also won one of the awards from the computer science department from Ashesi University. And it didn't end there. We also decided after the project, after we graduated, to take this up to build a startup, which is called Mayarisa. And this is how far your research can go as a REACH researcher. And I would also like to prompt anyone who is looking for an opportunity to volunteer or work with a health tech company to reach out. I'll put in the chat some of how you can reach out to us, links to our websites and everything, and also the link to read REACH research case study as well. Next slide, please. I would like to talk about developing professional skills as students. And just to remind you, I was a computer science student, but then I also needed skills which made me very competitive in the job market, and also which helped me pursue my passion for healthcare and research as well. Some of the opportunities I went in for just to broaden my perspective on the world and skills as a professional are joining the OSUN, which is the Open Society University Network, as a global media fellow. And obviously, I would like to mention this again, being a researcher at the REACH Alliance, and also participating in workshops with them, reaching out, always joining opportunity. One other highlight of my journey as a student was seeking the opportunity to join the University of Toronto as an exchange student. And also, most importantly, looking for opportunities that opened my mindset in terms of other cultures, like joining the Global Citizenship Learning Program from the Melton Foundation. And generally, I would also like to say that you shouldn't be based on just your major or your technical role as a student, but also try to be open to opportunities that broaden your perspective and also give you a lot of soft skills as well. I think I would end here, and thank you so much.
Wonderful. Thank you so much, Jochebed. Next slide, please. Great. So we're happy to take questions. As you can hear, there's lots of different research on the go right now. I know the researchers have posed questions into the chat where they are looking for input, suggestions, connections, guidance. So please feel free to connect with them directly. If you'd like to learn more about the REACH Alliance, the QR code is there for our website. We also are on all of the social channels, so please feel free to give us a follow and stay up to date with our latest research. Just thank you so much for your attention this morning. I know everyone has lots going on and lots of virtual meetings, and we're just really grateful you took the time to be with us today, and really again appreciate OVPI, the Health Collaborative, for inviting us. So that's it from us, and looking forward to questions.